Welcome everyone to the Wholesome Dog. We are so excited you've joined us. I'm going to give everyone just a minute or two to get connected to audio, to settle in. The good news is you don't have to have your camera on. You just have to listen. We do have the chat feature. We would love for you and Dr. Hazzah would love for you to ask questions. I'll introduce her in a moment. But thank you for joining. My name is Julie Lynn, and I am one of two of the co-founders of The Wholesome Dog. I am your host tonight and co-founder along with my good friend Wendy, who you will see and or hear from. If this is your first time here, welcome. We're so glad you're here. We, both Wendy and myself, are certified professional canine nutritionists, but more importantly, we are dog moms. And we have been through the frustration and the pain and all of the other unwanted emotions of trying to do best by your pet and being at a loss for finding answers and resources and guides. And so that's why we created the Wholesome Dog. We offer mostly free resources for pet parents and pet professionals on topics from nutrition to health and wellness to behavior and everything in between. In case you missed it, tonight is the third in our series of our Canine Cancer Awareness Month. And so we're really excited to have our guest with us tonight, Dr. Trina Hazzah. I will just say before I formally introduce her, Wendy and I had the very great pleasure of hearing her speak almost exactly a year ago at the Healthy Dog Expo. And if you are on the East Coast or can get to the East Coast in early April, I highly, highly recommend you check out the Healthy Dog Expo. It will blow your mind, the amount of experts like Dr. Hazzah and resources that enable you to feel empowered to help your dog live their best and healthiest life. When we first heard Dr. Hazzah, we were like, holy cow. This woman is amazing and we need to know her and get to know her and we need to work with her. And actually, it was at the Healthy Dog Expo that we had the idea to kind of come up with the Wholesome Dog. So the Wholesome Dog didn't even exist, but it was really kicked off because of all of the amazing information and speakers that we heard there. Dr. Trina Hazzah is really, there's no other way to put it, but she is a gift. And the fact that she is taking of her time and energy to join us tonight is just a gift in itself. And so just a little bit about her so you know why she's such a gift, and then you'll hear her and then you'll be like, oh yeah, Julie Lynn, you were totally right. She attended the Tuskegee University School of Veterinary Medicine, where she earned her doctorate of veterinary medicine. And then she went on to do a 3-year residency in medical oncology at the Veterinary Oncology and Hematology Center in Connecticut. And then, because apparently that wasn't enough, she's also completed the requirements to be a certified veterinary Chinese herbalist from the renowned Qi Institute of Traditional Chinese Veterinary Medicine. I have to brag for a minute, and I hope she brags and the people who love her brag. She is only one of four holistic and integrative veterinary oncologists in the US. 4, that's it. And at least half of them I know are women. They might all be because, you know, women. But what makes Dr. Hazzah particularly fascinating is that she really developed an interest in cannabis medicine while she was looking for effective integrative approaches for veterinary cancer patients. And over the past 8 years, and it might even be more than that since now, she has treated hundreds of patients with cannabis. She's been practicing medical oncology for almost 15 years. And today, she is not only the founder of Green Nile Inc., and my friend Wendy is going to put some links to Green Nile if you're interested in scheduling an appointment, a teleappointment with Dr. Hazzah, you can. But she's also the president and co-founder of the Veterinary Cannabis Society. So, you know, just a regular slacker who, you know, doesn't do much with her life. With that, I am so honored to introduce the amazing Dr. Trina Hazzah. Welcome, Dr. Hazzah.
Thank you, Julie Lynn. I really appreciate it. I love the introduction. It made me smile, so thank you very much.
Good, you deserve it. So tonight, the way we're going to do, folks, because really, I'm just going to step out of Dr. Hazzah's way because I'm not going to waste your time with like an interview style. She has been kind enough to just talk to us about veterinary oncology, the role of cannabis. And when we talk about cannabis, she'll explain like, what does that mean? No, it doesn't mean your dog is smoking a joint, despite what my parents might think, who are in their 70s. Um, and really, what an amazing plant medicine, because at the end of the day, that's what cannabis is, that it is, and how it can help our pets on their journey with cancer. I also just want to give a shout out to a very good friend of ours and to Dr. Hazzah's. Diane Schlesinger is here, and Diane, we're so glad you're here. Diane recently lost her own canine cancer warrior, Apple, who was actually a patient of Dr. Hazzah's. And Diane has given permission to Dr. Hazzah to talk a little bit about Apple's journey and really the amazing benefits that not just cannabis, but integrative oncology was able to provide to Apple. And so with that, I am going to step aside, and Dr. Hazzah, we're going to feed you questions as they come. So folks, if you have questions about any of this, you can put them in the chat. The usual disclaimer is like Dr. Hazzah cannot specifically provide information or diagnosis for your pets. But you are more than welcome, as Wendy just put in the chat, to sign up for a tele-appointment with her so that she can become your dog's doctor if you're so inclined. So Dr. Hazzah, take it away.
Thank you, thank you, thank you. So I'll just talk a little bit about myself so you all know a little bit about my history and why I decided to go into integrative medicine. I actually started off as a conventional oncologist and enjoyed it actually a lot for a period of time. Probably, I don't know, 5-7 years, I was doing mostly conventional oncology in Los Angeles. And what I realized is being in LA and people being so open to other modalities, folks were coming in saying, like, is there more that I can do? What about acupuncture? What about herbs? What about Eastern herbs, Western herbs? What about cannabis? I'm on cannabis, my, brother's on cannabis, whatever it may be. And what I think doctors hate most is just not knowing the answers, right? It really bothered me. I would sit there and be like, oh, I don't know about that, or I don't know if there's an interaction. And it started to really bother me. And I felt like I wasn't able to do everything I could for my patients. So I went back and got my certification in Chinese herbal medicine. And during that course, I learned a little bit about cannabis. And out of all the herbs I learned about, cannabis was without a doubt the most fascinating of all of them. There's over 700 compounds in the cannabis plant. And so that alone was really exciting. And I was like, wow, is there actually research on this? And then I found just with THC and CBD, there was over 100 publications just on the anti-tumor effect of CBD and THC. And there were actual mechanisms, and these mechanisms overlapped with many of the conventional modalities. But what I started to realize is I got very excited, and it was like, I'm going full in learning about the safety and so forth. Before even the Farm Bill, I was starting to use it in my patients, and I was starting to get an idea of what was safe, what were safe doses, what weren't safe doses. And then I started to realize that certain cancers responded much better than others. So then instead of just saying like, everyone just try cannabis because there's some mechanisms that it might work, it really became this conversation of, do we use it for some cancers more for palliative? And then for others, do we use it for more anti-tumor effect? And, what I learned is that, carcinoma type tumors tended to respond much better from an anti-tumor perspective to cannabis than sarcomas. And for almost all tumor types, if there were patients that were suffering either from their cancer or from the treatment, then we could implement cannabis for more of the palliation, the anti-nausea, and the reduction in pain and the euphoria it can produce. I mean, I take 15-year-old dogs that weren't walking well, and some of them will be like having zoomies at night, and their pet parent will tell me like, well, I had one that said to me like, look, he's so lethargic. Can you just give him something that will help him? I was like, sure. So create this formulation, off it goes. Dog is running around as the zoomies at night. And then the owner says to me, get a message. Is there any way you can slow it down? It's too much. And I'm like, I don't know. I mean, it's supposed to be a plant that balances, but in this case, it went, it was just like, you just took this older dog and made him a puppy overnight. At least it was only at night though. That was, I think, what was the problem is like she'd give a 6 o'clock dose, and by like 7, he was running around, and I think there's so many potential benefits, but with herbs too. I mean, in Chinese herbal medicine, I learned about it and I thought it was super exciting. But then I kind of wasn't a believer until I started to see it myself. I think many of us are about that, even within our own bodies. We're like, this supplement seems great, but I'm going to try it and give it a month and see. And then we start to ask ourselves, do we feel any different? Do we think differently? Do we, right? I mean, some of these medicinal mushrooms that are functional mushrooms, right? Many of them I use in my friends that are like postmenopausal and things like that. And we're just like, why is it we can't remember anything anymore? Well, let's try these mushrooms. And then we'll try them together and say, okay, you take it and I take it. And then let's regroup and see how we feel. That's how I was practicing a lot of medicine, was like, well, it seemed like here mechanistically, this should work this particular way. But why don't I start to try it in my patient population? Always confirm safety is number one. And then number two, let's try to confirm efficacy. And I started to see some of these herbs make such differences, not just in quality, but also quantity. Like these animals were living much longer when they had Chinese herbs. What I noticed in my practice was oftentimes the combination of Eastern and Western together worked really well. When I mean that, I mean like Eastern medicine and Western medicine can work really well together, or conventional and alternative can work really well together. And so these patients were definitely, like most of them were honestly living further than the average of that disease population, but also their quality of life was so much better. So as they underwent chemo, their chance of nausea was reduced. Their pain level was reduced. They were happier. They were moving around better. The owners were saying that they weren't as anxious when they were going into the vet to get their chemo or whatever, radiation, whatever it may be. So I was looking at kind of both factors and noticing that a lot of these alternative methods were making a difference. A really high quality nutrition. We're taking these dogs that had chronic gut diseases and improving, where they were in the past to a new reality for them. And so I honestly, like, I stand very strongly, no matter, who is questioned what I've done in the past. You have a lot of conventional doctors will question, well, there's not enough science. And you'll hear Dr. Pope and Kendra and I, we lecture sometimes together. We'll oftentimes say, there's a lot more research with some of the stuff we're doing than there is on the conventional side. We take something that's FDA approved on the human side and say, like, let's just start using it in animals without doing any animal studies. But they like to oftentimes say, well, there's not enough research. And if in cannabis, I got that a lot from the veterinary medical boards that I spoke at, trying to really provide, when I spoke with, the Veterinary Cannabis Society, trying to push legislation for, pro-cannabis for veterinarians, the veterinary professionals specifically. We got that at the beginning. There wasn't enough research until we show them white paper after research and meta-analysis and things like that, that really showed, I mean, just in starting in 2018, there's probably over 30 publications on cannabis and companion animals. So there's not a shortage as much. There's a shortage on clinical trials for anti-tumor effect and shortage on clinical trials for, say, anxiety. There's only a few here and there. But safety, we have significant number of trials on safety, more so than we do on a lot of the pharma drugs that we're using in our pets these days.
So two things, Dr. Hazzah. I just want to say, I tell people all the time, Chinese herbal medicine and other, ancient modalities, right? Like acupuncture and things like that. There's reasons they have been around for tens of thousands of years, right? It's not because they're not working, right? And so I appreciate that. Would you mind just, I think a lot of people, when we think oncology, we just think cancer, but can you explain how oncology really runs the full gamut between preventative medicine as well as, treating active disease and kind of, how do you look at oncology in dogs?
Great question. So with oncology, we know that I think the statistics are now, right? I think it's over 50% of dogs over the age of 10 will get cancer. That's not a small number. That's
No.
not a small number at all. And so one of the things that we need to start thinking about is we need to start thinking about preventative modalities and things we can do to try to provide our pets as much longevity and high quality longevity as possible. And then part of that needs to be reducing exposure to carcinogens, right? And we talk about it. We've talked about it for a long time, but it's everywhere. I mean, there's plastic everywhere. There's, Roundup, right? And glyphosates and I mean, all of this stuff that our pets are exposed to. There was an interesting study when I did my oncology residency. I was somehow really into bladder cancer, like the bladder and prostate. I have no idea why urogenital tumors were my jam, but they just were. Like I like them. I like
Scotty
them.
dogs. Scottish
Yeah,
Terriers.
Scotties, exactly.
Yep.
19 times more
Yep.
increased risk, right, than the average mixed breed dog. It was fascinating. Even before, while I was in vet school, I was interested in it. So I did a lot of my research in that arena. And one of the things I remember reading that I always had an interest in alternative, and I don't think I even admitted it to myself, but I ended up always going down like rabbit holes when it came to alternative medicine for a lot of the cancers. One of the things I read was like, they did this study in Scotty dogs, and they found that Scotty dogs that ate it was green leafy vegetables and colorful vegetables
Yeah.
were at a like 4.5 times reduced risk of developing bladder cancer, right? And I was like, wait, this is a published study.
Yeah.
Why are oncologists not talking about this? Like, there's a study looking at the increased risk of dogs that were exposed to, insecticides and herbicides, right? And what did that look like? Like in regard, like it was like increased risk, absolutely, especially right with like some of those insecticides but herbicides like that were in the grass from
Yeah.
lawns that were treated with some of those pesticides and things like that. And so they looked at like 4-HD, one of those very common ones, and there was increased risk in Scotty dogs. So I found all of that very interesting because it's like if we knew this, why are then we're just sitting back and saying, well, when it happens, we're going to keep working on ways to treat it. But as oncologists, I think our job was also to sit there and talk to the woman that or man, whoever walks in with their little Scotty. Oftentimes, I don't know about you all, but many Scotty owners don't just own one.
Yeah.
Like just they walk in with a slew of Scotties. It's like I got two, I mean, there's like they just come in a pack, right? And
Yeah.
and they're just like these little old men or women that walk in, little beards, right? They're so cute. And they have the puppy sitting there and
Yeah.
they're just talking to me and they're sad. And I'm like, well, is my job as an oncologist just to talk to you about this one?
Right.
Or did I take an oath to do everything I can to protect animals and do no harm? And one of the ways I think of doing no harm is also education. So perhaps I need to take a moment and talk to you about here are some interesting studies. You should read them. And I don't know what you're treating your lawns with. And you may want to reconsider. And are you smoking in your household? Because smoking increases the exposure of bladder cancer in people. Granted, it's a little bit of a different form of bladder cancer in people than in animals. Some people get the invasive form, but mostly get more of a superficial form. Although, if we know that smoking is an absolute risk of bladder cancer in people, if you're smoking in your household, let's have that conversation now, today, while you're sitting and meeting with the oncologist. And then obviously having the conversation about nutrition, which we do a lot of the times, and
Yeah.
the problems that we're encountering and the contaminants and even a lot of the supplements that are out there. Like you need to know where your supplements are coming from. You're giving your dog sometimes, I tell people all the time that are treating their dogs with any chronic disease, right? That are using supplements, including cannabis. I'm throwing cannabis in the supplement family because we have no idea where to put it at this point, right? It's drug, it's a supplement, it's a combination of both. But right now it's over the counter as a supplement. And I also oftentimes will say, your dog's been on this for 2 years at twice a day, and there's no certificate of analysis, meaning we have no idea what's inside of it. We don't
Yeah.
know that there's full of contaminants or not. I think that's problematic, right?
Yeah.
Let alone there's no difference with a lot of these Chinese herbs. We're not sure. You need to know where they come from. You need to know they're clean because we're chronically dosing our patients. And I think we just seem to trust pharma and say, well, it's fine. We're just been giving this for years. But like we need to ask questions about all of this stuff, pharmaceuticals and, and a lot of the alternative treatments.
I love that and I appreciate that because I sometimes feel like a broken record and or that annoying canine professional who's like, "Oh, you have a golden retriever? Do you know about mushrooms? Is your dog on mushrooms?" Right? Even if it's a puppy, is your dog on mushrooms? Right? Like, let's talk about that. Oh, you have a dog? Are they on mushrooms? Like, it doesn't, but especially the high risk breeds, right? So I love that. So we've gotten quite a few questions. Speaking of fertilizer, Haley has a question. She says, I live in an apartment complex and don't get a choice when they treat the lawn for weeds or ants. Outside of keeping my dogs off the lawn and wiping paws for a period of time after, is there anything else I can do to help prevent cancer from those toxic exposures?
Great question. So you're smart to try to keep them off the lawn, like the rolling on the lawn and all of that stuff. And I would be very careful. I think wiping the paws is super smart. The other possibility is if you talk to the gardener of whoever's doing the lawn and ask them what they're using. And if it does seem like you do some research and you're like, okay, this is toxic. These have been all reported as toxic chemicals. Then one of the things you might want to do is reach out to like a local holistic vet and see if they can do detox protocols. I mean, I think there's something to be said about that for all of us, like as humans and our companion animals, that if we know that there's going to be exposure, then why not do detox protocols every once in a while and find things that will help detox the liver and help the liver, some things like glutathione and homeopathics that might be able to help the liver detoxify at a much higher rate. But I don't necessarily think you want to be on it all the time. It's really
Yeah.
hard on the system. But every once in a while, doing a detox and having a professional support you through that, that's one. Another option, I mean, that's one thing. Another thing that has come up that I'm just thinking of right now in my mind is you could have your holistic vet also do like vitamin and mineral testing, but mineral and specific for this case, because if there's large amounts of aluminum or something like that, or cadmium or something in whatever they're using on the lawns, we do a lot of mineral testing where I work. I work at Integrative Pet Wellness Center in Palos Verdes. I go there a few times a month. They're an amazing establishment. Diane came with Apple. That was the first time I got to meet them. It was like love at first sight when I saw Apple. I think that's like
It
with
always is with
everybody.
Apple.
No,
Yeah.
it is. And you know what it is like she was like the dog that made you feel like you're the only special person in the room, right? You're like, wait, are you looking at me like that? What? Right? Like that's and Diane knows I talked to her about my son hears about all my patients, but there's something about him and Apple. And to this day, he asks me still Diane, he had me watch videos of Apple today on Instagram. I literally don't barely know how to use Instagram still, but he doesn't care about my Instagram, which really isn't very big compared to Apple's, but he has me go to Apple's, Diane. Like today we did it just today. And I needed to say that to you because he ran around my sister's house showing her Apple's Instagram page. So I want you to know that like, it's just she's like living beyond like I mean her soul is like and her
Oh,
spirit is just still lingering around everyone with so much love and inspiration. I just feel that and I know that and I wanted to say that to you out there. I know if you're listening.
yeah. I don't know if
Um
you saw the chat, but Diane said, I love that. Did you tell him she passed away?
Diane, I didn't tell him. You told me to get ready to tell him. Remember, you were like, Diane asks me. She asked me, are you going to tell him? Or what did you ask me? He says, I'm like, are you going to tell him or how are you going to tell him? And I told you, I don't want to talk about that right now. Like, we don't need to talk about that. And then he like, I couldn't tell him. I looked at his little 4-year-old face and I just could not tell him. And I'm like, I don't know. Diane, I might need your help. Like, you might need to like, tell me how to tell a kid this. Like, I'm going to have more of a difficulty, honestly, I think, telling him about Apple than I will our own dog.
Mm,
Like, there's
Mhm.
some connection he has with Apple. He sleeps with a pillow that you made for him, really for me, and that became his. And so, so
Okay.
we can talk about it.
Well, we are, I don't know about everyone else, but I'm gonna start crying. So
Mhm.
we all have had that heart dog, that's just so special and touches us.
Mhm.
So that I don't start bawling, because I'm supposed to be, keeping my stuff together here. With all love and respect to Diane, I think we are going to move on to another question. Um, but yes, Apple was an incredibly special girl and has an amazing legacy, and for that, we're all
Mhm.
very grateful to Diane for bringing Apple into the world to us. Um, so Dr. Hazzah, can you just give a very basic intro to like cannabis and oncology? Like, if you've never used cannabis because you're like me and you grew up in the 80s and your mom just told you how terrible it was, and just say no to drugs and we all got poisoned by Nancy Reagan, uh what's what's the modern like scientific base for cannabis and its role in oncology?
Yeah, good question again. The way I would look at it is there's two places that I think cannabis plays in veterinary oncology, and I would probably say oncology for anyone, but we'll talk about veterinary oncology here. One would be more of a definitive intent, like I'm gonna kill cancer, and I'm gonna do that either directly, just with cannabis alone, or I'm gonna use it adjunctively along with something else. And something else could be chemotherapy. There's several studies looking at the potential benefit of combination and how you might actually be able to boost the effect either additively, so they're 1 + 1 is going to equal 2, or what they call synergistically, right? Which is really 1 + 1 might equal 5. You're actually boosting the effect of one or the other. You're getting even a greater effect, right? So there is some research on that. There's a small amount of research on the potential benefit of combining it with radiation as well. Targeted therapy for sure. There's some research on that, and then anecdotally and through my experience, and I have several cases to prove that there is some efficacy there of potential benefit of combining both. So I think you can see it. And when you think of how cannabis works from an anti-tumor, there's a few different ways. One is that it can actually cause the cells to cause or create a cascade of cell suicide, right? So it's something called apoptosis, and it happens through different mechanisms. But that's one of the ways it causes cells. It can cause cell death through apoptosis, something called autophagy. It can cause a reduction in proliferation. So for cancer to grow, it needs to proliferate and make tons and tons of cells. And so for that, one of the ways that cannabis can work is it actually stops that cell cycle. It also can work on certain growth factors or inhibit certain growth factors. So inhibit proliferation that way. One of the other ways it can work is that it can have what they call anti-angiogenic effect, which is a fancy way to saying anti-new blood vessel effect. So for cancer to grow and spread, especially certain tumors like sarcomas, they actually need blood vessels to spread what they call hematogenously. It spreads through the bloodstream. And that doesn't just happen. It actually has to have blood vessels that grow around the cancers to allow the cancer to bust through the membrane, what they call the basement membrane, and it goes right into the bloodstream or the blood vessel. And so there are multiple mechanisms that show how that can be inhibited through cannabis. And when I say cannabis, I'm really talking about it's going to be mostly THC, CBD, but there's other cannabinoids that have been looked at to do some of those things like CBG, CBDA, THCA, CBC, CBN. It's like I'm reading you the alphabet, but other cannabinoids. There's over 150 of them, and those are some of the ones that pop in my head as the research has come out to support. And then one of the last ways is it can augment the immune system. And so there's some older evidence that looked at that cannabis might actually enhance immune surveillance and enhance immune response. It's a little tricky because high doses, there's some thoughts that it might actually interfere with immune surveillance and might be problematic through downregulating certain parts of the immune system and upregulating certain T cells that could be problematic. So it's always like, and they think it's THC that's doing some of those, the more problematic. But then when you look at all the studies, it's like there's over 100 studies just showing the anti-tumor effect of THC. So then you're just like, you talk to
That's
a lot of the
amazing.
human researchers now, and they're like, I'm not convinced that THC is really doing that from a clinical standpoint. I think we need to think through it and make sure that there isn't any problems. But I'm pretty conservative on how I utilize which cannabinoids for which cancers.
Mhm.
So that is the anti-tumor kind of, we'll call it leg, right? Like we'll say that part of cannabis can be really, really helpful is going the anti-tumor approach, either by itself or in conjunction for certain tumors, not all. And then the other side is more going to be the palliative. And that is, I think, people, I had a good consult with someone the other last week or something, and she asked me this really important question, which was like, what's the chance of this really working, Dr. Hazzah? And I was like, oh, that's a great question. I think a lot of times we don't ask that question, maybe because we don't want to know, or maybe we just don't ask it. But, from an anti-tumor perspective, I think with those, so we don't have a lot of research from the anti-tumor perspective. And I think we're probably at, I don't know, probably less than 15% of cases where cannabis by itself would really kill cancer. I think in conjunction, we're seeing probably higher rates, but then you start to add, then you'd have to convince the world, was it the cannabis that was added or was it that
Right.
treatment? And I can just say, well, I've done this for 15 years and I can tell you what I've seen in almost all cases. And now I've added this in and now I'm getting double the time. I think it more likely is this, the combination. But we
Yeah.
need to start publishing those papers to see, and really prove that it's doing that. Right. But from a palliative perspective, I'd say probably 80+% of cases I'm seeing improvement. And
That's
I'm not,
awesome.
palliative does not have to mean end of life. Like I think we go to this end of life regimen of like, it's the end, there's nothing left, let's try cannabis. Yeah, there's also that where we see a lot of those patients be able to end their journey with more comfort, especially if it's really more the chronic diseases where these patients are in a significant amount of pain or they're not eating and they're miserable, and like those, not the ones that are more acute. Those I don't think makes much of a difference. But as they're undergoing conventional therapies, it can make them feel better. There's absolutely, published evidence to support it being an anti-nausea agent. And actually, there's an interesting paper that was published years ago that looked at, they compared human cancer patients and they provided them anti-nausea to like more of the conventional anti-nausea medications and cannabis. And many of those patients, they they um they prefer the cannabis over the anti-nausea medication.
You know, I'm going to interject just to say two quick things. One, which if you're like, what the hell is CBD, CBG, THC,
Mhm.
terpenes, all of that, what I'm going to say is next week, a week from this coming Thursday, we're going to have Angela Arlino give like a whole primer on cannabis. So we're going to talk about CBD, CBG, THC. We're going to talk about terpenes. We're going to talk about adaptogens, all important components of the endocannabinoid system, which is what Dr. Hazzah is trying to cram into a very short amount of time. So if you're like, tell me more about this, then you should absolutely sign up for next week. The other thing I'm just going to say is I'm clearly not a dog, but as someone who has lived with a chronic illness and who has had chronic pain, who's had chronic gut issues, I have used and anxiety because it's 2024 and most of us seem to have it. I have used throughout the years both THC and CBD, um where and that has helped where conventional pharmaceuticals have not. And I just again, I was raised by fairly prudish patient or parents, so I was the one that convinced them like this is a good thing. I will say I also now I have a dog who is 3 years old and has chronic gut issues, and allergies, and she absolutely benefits from CBD. And God forbid, something more serious happens down the line, I will definitely be giving Dr. Hazzah a call and, exploring if THC is something that she needs. But I just want to also encourage all of you who are listening in, like, like I mentioned earlier, like there's been a very effective anti-drug, and I'm saying this with air quotes, lobby over the last 40 years. And cannabis has been around again for tens of thousands of years, and it has been an amazing drug. If you've ever been in pain or you know somebody who's had cancer or MS or whatever, I would take THC over narcotics any day of the week because I feel like more myself, right? So I'm just gonna give a little plug as both a dog parent and as a patient myself. That there are real benefits out there, and don't let um misconceptions or beliefs that aren't necessarily founded in science but kind of like popular thought, right, hold you back, especially because I know everyone here, we would do anything for our dogs, right? We would do anything to keep them out of pain, or we'd do anything to keep them around longer. And so really, we call it the wholesome dog here because we're all about integrative. So there are absolutely, times and places for traditional pharmaceutical drugs, and then there are times and places where we need to go back to the fundamentals of medicine and what Mother Earth has given us. So, thank you, Dr. Hazzah. Um, I have a few more questions. Could you just briefly, because I've always been curious, what is mistletoe therapy? And do you use it at all?
So I don't use it. Usually I have either my experience has been either with Dr. Pope or at the Integrative Pet Wellness Center. We're using it there.
Okay.
But similar to other kind of poisonous plants, it's giving really low doses of a poisonous plant to kill the cancer. And we do that. And that happens because you actually promote this immune response. So you get like a release of certain cytokines, which are proteins that are released from the immune system that can actually kill cancer directly. And so I don't use it, but I think that there's definitely I mean, if you think about it, it's very similar to chemo. I mean,
Yeah.
chemotherapy
Yeah.
comes from plants, right? Like you think about specific chemotherapeutics coming from the Pacific U or, so I think that it's probably it's very similar. I would say like look at bloodroot, right? Like Salfont as a bloodroot, right? Like a lot of these are kind of toxic plants that you can give at really low doses to kill cancer. So that's how I think of mistletoe. I think it needs to be given by someone that has experience.
Sure.
That's not something that I do because there's people around me that do it. So
Yeah.
I've kind of gone down the road of like I want to be really good at a few things. Like integrative oncology is my thing, and within that, I do like herbs, and I do some mushrooms, and I do cannabis, obviously. Um, I do some Western herbs as well, but I've not. It's funny, Dr. Chen at Integrative Pet Wellness, like, do you want to learn to do this? And I said, no, I want you to learn to do it
Yeah.
is amazingly, and then we can combine our
Yes.
forces
Love
because
that.
there's just only enough room in my brain to have all of that stuff. Because, I've always believed this is why I always say that general vets are way smarter than me as a specialist because they need to know like a little bit of a lot.
Yeah.
And I don't know how to do that. I can just know a lot about a little. And so I want to, that's my answer to your mistletoe question is I understand it. I kind of understand some mechanisms a little bit behind it, but I think Dr. Pope and Dr. Chen have been the ones kind of teaching me a little bit. And I've had some of my patients absolutely use it along with some of the modalities that I'm using.
Yeah. Awesome. Okay. And just a quick follow-up to that. Are there not several forms of mistletoe, or is it just one?
There's several. There's
Okay.
several. Yeah. And
Fascinating.
there's some that are a lot more. Think about it. It's like there's going to be some forms that have a lot more of kind of the poison, if you will, right?
Yeah.
Like, so
Yeah.
a lot more potent than other forms.
Okay. I have a two-part question here. So the first one is, why doesn't my vet understand THC and dosing? And then we're going to follow it up with, how do you estimate what starter dosing of cannabis in general, whether it's CBD or THC, for your dogs that are seniors, or, or also dosing for issues of joint pain or gut issues? Like, where do you start?
Okay, great question. So your vet unfortunately doesn't know because your vet never learned about cannabis in veterinary school. They just didn't teach it at that time. And we're slowly with the Veterinary Cannabis Society, the 501(c)(3), nonprofit that I'm the president of and a co-founder. We're like working our tail off this year to try to find a way to infiltrate this education into veterinary schools, because then you wouldn't have to ask that question down the road. It would just be there and vets would know about it. We've started to educate a little bit in some of the veterinary schools, but we want it to be part of the curriculum. Um, so your vet, it's not really their fault at all. Like, do you know how much continuing education your vet has to do? Like they just didn't do the cannabis one, and they probably didn't do it because it's either illegal in their state for them to even talk about it.
Yeah.
And so they just went off and did continuing education on something they could legally do in their state. So two reasons vets don't know about it: they're just not educated about it, and the other is they're terrified of their disciplinary action from their veterinary medical board. So I actually have a lot of empathy for veterinarians in this case. Now that if they are in states that they can legally discuss it or recommend cannabis, and remember, there's no prescription because it's not something that's federally legal. We're not going to be prescribing a THC product, and there's actually no FDA approved cannabis products for pets, so there's no prescription. It would either be a discussion or a recommendation. You can dispense and administer. There's certain states like Nevada and California that allow for dispensing and administering of CBD that's derived from hemp. So if you're in certain states that allow for that, then you could ask your vet, like, hey, I know you can start talking about this more. Do you think you could get some more education around this? And basically, do you have the time to do this? Would a
Yeah.
veterinary hospital allow for someone like me or someone else to come and educate? Because we have the Veterinary Cannabis Society, it all started because we wanted to change legislation in multiple states for veterinarians and give them really a voice in their state to be able to talk to pet parents and not make them feel that they're alone in this topic. But also there's an entire educational component where we have hundreds of peer-reviewed journals, and we do, chats with vets, and we do a lot of we just put out a 7-hour course on the basics of cannabis
Wow.
medicine and veterinary, the cannabis in veterinary medicine. And that is can either be for vets that need continuing education credits, race approved credits through VIN, the
Yep.
Veterinary Information Network, or people can just join as a VCS member and take the course for a really minimal cost. And you just don't get race approved credits, but you get the entire course exactly as you would on VIN. And so we're really proud to be able to have that, because any vet could do that. It's self-learning. Take it on your own time. You're going on a trip, you want to just listen through audio, whatever it is, that's an option. And it's not just for veterinarians, everyone. Like pet parents can absolutely take the course.
That's awesome.
Yeah, companies like that are creating pet products, they can take the course. So if you go to vcs.pet, that's vcs.pet, you'll be able to see how you can join and then take the course. It should be available in the next week or so on the website. We're just getting the web designer to put it on there, but it's all
Great.
ready to go.
Great.
And then your second question was dosing. So, it's dosing is so personalized. It's like if, Wendy and I, we decided to take the same product. We're both really stressed just because it's life, and we all get stressed in life. And
Yeah.
we're talking about it with the same stress right now. We're going through the same thing. Her and I take the same product, and I'm like, so relaxed. I'm like, thank God I took this. I am so relaxed. Wendy is like paranoid as can be. She's like, like under her, bed, like a cat. I made you a cat, Wendy. And like, you're super stressed. And you're like, what the heck? We took the same dose
Yeah.
if you did milligram per kilogram, we took the same exact dose, proportionally, took the exact same product. Well, we have different bodies. We have different endocannabinoid systems. We have different, like, our biologic systems are so different. How can you then say that we're going to have the exact same response? That's like cannabis medicine,
Yeah.
honestly. As I
Yeah.
think cannabis is a very, very much personalized approach. If you read the New York Times last week, that was in the New York Times. We had front page, right? That
Saw that.
cannabis and veterinary medicine. And that was one of the quotes I had, was like, it's personalized. And that is a huge thing. It's very different than certain conventional medicine where it's like gabapentin. 5 to 10 milligrams per kilogram. Every dog's the same. I mean, even that, how many dogs take gabapentin? It's like my dog has to take, it's a Great Dane, but it takes a fraction of what your Labrador takes. I think we're seeing that more and more because we're now open to the idea of that one dose isn't going to work for, for every patient. And cannabis is very much that. So the way I would say to you, whoever asked that question, I don't have your name because I'm not looking at the name that asked the question, is what my best recommendation is if you find a product that is reputable and you really like it and all of that, what I would say, is that Lisa that asked it? I just saw something come up.
It was actually Wendy.
Wendy, you asked the question? Yeah, Wendy, yeah, that's
Sometimes she
great.
throws some softballs in there to
Yeah, no,
keep
and
going.
I loved how I made you part of that with me then. So So I would say that like anyone that is listening, like I would take if a product you love is out there and it has any THC in there, it's a full spectrum. They're call it doesn't even matter what they call it at this point. They call it anything. They call it a partial spectrum. They call it anything. Who knows what the terminology even means now? Just get a certificate of analysis, which is a printout from a lab that most websites should have associated with the product. Click on there. If there's any THC, I would say if you have an older dog, a senior dog, Wendy, which is what you asked, I would say any dog probably over the age of 10, I would just start at half the dose that's recommended. I don't even care. Like just start with half. What's the worst? It doesn't work because you're just going to start low and go slow and increase the dose. So you'll start low and you'll say, oh, I started with half. And then next week, I'm going to go up a little bit more. And the next week, I'm going to go up a little bit more. And what's the worst? You took an extra few weeks to get to the optimal dose.
Yeah.
Versus if you overshoot that optimal dose, you've kind of screwed yourself because you may even overshoot. That optimal dose is the dose that actually works, number one, but it also is the dose that won't have side effects. So if you overshoot that, then you may just have side effects and not have any positive, and you'll think it doesn't work, but the reality is the dose was too much. So I think in an older dog, just start low. It's like you were saying, for your parents, like your parents aren't going to start the same dose that a 20-year-old is going to start. They would
Right.
start lower and then gradually increase the dose.
I'll also just add that if you're lucky to have access to a holistic vet who does nutritional response testing, or we also call it muscle testing, if you take the CBD with you, they can actually determine through muscle testing. We just had a repeat muscle testing with my dog, and he was like, oh, last time she was here, she needed a half a dropper. This time she's only at a quarter of a dropper. And I'm like, great. I'm also saving money too at the same time, right? So that's awesome. Okay, thanks, Dr. Hazzah. All right.
The other thing too, they can go to the VCS website and click on like the list of practitioners. And then
Awesome.
there's lists like globally that you might find someone nearby that you can either get on a call with or meet with, and that can help guide you as well. Okay, sorry, go ahead. I just
No,
wanted to say
that's
that.
great. So speaking of global, I want to give a shout out. Our friend Lisa is here tuning in from Australia. I don't even want to do
Nice.
the math to figure out what time of day it is there or night. But thank you for joining, Lisa. You've been on all of these so far. One of your former patients, this is Lisa Moeller, said she wanted to say hi. You were Brooklyn's oncologist for a year during COVID.
Yes.
It looks like you remember her, but she had a high-grade mast cell tumor and is still thriving almost 4 years later. That's awesome, Lisa.
Yes.
Thank you for sharing that. That makes us, she said she's still on the protocol of Chinese herbs and mushrooms. I stopped the chemo about 2 years ago. Do you think there is a point that herbals become ineffective? And also, and I'm just going to preface this by saying, Lisa, we're going to answer your next question next week. Okay. So I'm not going to ask Dr. Hazzah to answer that just because we've got a bunch more questions. But so yeah, Dr. Hazzah, do you think there's a point that herbals become ineffective?
And I think like anything, Lisa, like any conventional or not, cancer can develop resistant mechanisms. It doesn't matter if it's alternative or conventional. I think after being on it for so long, it may be reasonable at some point to start taking her off. I am just trying to feel like, I wonder if you and I should talk. And then maybe you can come through Grinnell, or if you want to bring her, I get to see her and give her kisses. Like you can bring her to the integrated pet wellness. You live in the valley. Do you live in the valley?
So
you probably don't remember, but I was in Redondo, and Brooklyn is now on the East Coast. So she has gone to
Oh,
Dr. Pope.
oh, good. Oh, that's exciting. Okay, okay. I didn't remember you. Now you're saying this and like something's coming back, like you guys moved.
Yeah.
Um, so what we could do is, what is Dr. Pope saying? Because I mean, that's like my twin, basically. Like,
Yes. Yes.
what is
She's
she
beautiful.
saying? What is she saying about herbs? Is she saying that maybe you should start taking her off? Or because some of those herbs are just good for her immune system too, is what I'm thinking. Like, I don't know if I would take her off of those, but what is she saying? I'm just curious.
So it's to be honest, she's like 2 hours away. So I've
Yeah.
only seen her once. I need to do a follow-up, but it was mentioned that possibly we could, think about taking her off, but that's been over a year ago and I have not. So I should
I
follow
mean,
up.
you can either follow up with her or just you and I just come through Green Isle and I can still chat with you a little bit and I mean, legally, I can do all of that. I can do an educational consultation with you. And
Okay.
so if you want, we can do something like that and talk through it together and talk about pros and cons and where she's at. Or if you'd prefer Dr. Pope, like putting her hands on her, then see her. One of us will be able to help guide you a little
Okay.
bit, but I think there might be a place to start pulling her off of at least
So
one, if not.
the last chemo that she was on, I think it was chlorambucil.
Uh-huh. Uh-huh.
But I took her off of that 2 years ago. And
That's
so
amazing.
Dr. Pope doesn't think that it was actually a high grade, which
Or it
is
was a high grade that
probably,
responded
she
really
said it's
well.
kind of could be common that it was a misdiagnosis. I don't know. It's 4 years later.
That's amazing.
Yeah.
So,
Yeah. No, she's right. I mean, or it was a high grade that responded really well, right? Like we both have those cases where they're like, you're not really reading the book, Brooklyn. You're not supposed to be here, but she is, right? So
right.
I think that
Yeah.
I think there might be a place for us to start pulling her off of the things she doesn't necessarily need every day. And then instead, maybe there's other things we can add in as preventative as she ages.
Yeah, I think that's perfect. Yeah, I'll schedule something
Awesome.
for
Okay.
sure.
Thanks
Is
for
it
joining,
best to
Lisa.
go through Integrative or directly to you?
Just come through to Green Isle because you're far away. For integrative, you have to be in California to see me. So
Okay.
just come through the
Okay.
greenisle.org website, and then
Okay.
we can schedule a 30-minute or hour, whatever works for you.
Okay.
And
Perfect.
Lisa, if you scroll up to the top of the chat, you'll see the link to the Green Nile website.
Oh, yes, I've got it.
Okay,
I think
perfect.
I follow her already. So
All right, perfect.
Thank
Thanks,
you.
Lisa.
perfect. Thank you so
It was
much.
good seeing you, Lisa.
Yeah,
Yeah.
good seeing you. Actually, we never actually met because it was during
Oh, it
COVID.
was over the
We
phone,
were only on the
right?
phone.
Well, I met your girl a ton of times.
Yes, yes,
That's awesome.
yes.
All
She
right,
was good.
next question. Thank you, Lisa. Okay, so our friend Diane, she says, as we know, I've now lost 2 golden retrievers to hemangiosarcoma. I'll be getting my 3rd golden later this year. She will be from a breeder who naturally rears. She'll have minimal exposure to toxins and she'll be raw fed. Are there supplements I should give her during her lifetime as a chronic illness / cancer preventative? And what age should I start at?
Great question, Diane. Um, hmm. Trying to think of the best way to answer this. You're definitely not going to start at too young. Like I want her fully matured, so I wouldn't start her anything because a lot of these, I mean, I would think you just don't want to interfere with any of her normal maturity and hormones. I just don't want it to interfere with any of that. So you're feeding her super good quality raw food. You're feeding her. I would make sure that because you're feeding her raw and you're not giving her some AFCO branded food, that you're getting her minerals and vitamins checked because sometimes those companies that either do raw or gently cooked or fully cooked foods, where they source it can sometimes, especially if it's a fish diet or anything like that, can be problematic from a mineral standpoint. So I just did this with another dog where they were home feeding, and so I would consider mineral testing like at least once. I would do it probably once a year. So that would just be part of your regimen, and vitamin testing to make sure there's enough like vitamin D and things like that. So that would be definitely part of it. Then from a supplement standpoint, I would definitely be considering things like making sure gut health is optimal, and is the raw going to be enough, or do we need to support the gut through like providing digestive enzymes, providing very specific probiotics, not just like a one-all probiotic, but something that she may need, which is with a microbiome evaluation at some point. I wouldn't do it right away. I would wait like at least a year or 2 years, I would think, just get her used to this food that she's on and things like that, and then start to evaluate where she's having deficiencies, right? Like, so I would look for that. And then I would also consider kind of overall vitamins that would support her. And then I would probably even do some sort of longevity mushrooms. Like I would
Yeah.
do I would do reishi. I would do reishi. I would even consider, I mean, I would consider maybe a combination of really high quality mushrooms, right? Reishi, I think I love reishi for longevity, but I think many of those mushrooms, maitake, turkey tail,
Chaga.
chaga, I mean, there's so many lines made. I mean, all of these mushrooms have so many benefits that I think about a lot of these kind of adaptogen type supporting agents would be really helpful, because what you're trying to do is say like she's still living in the LA area and she's still gonna, I'm assuming you're getting a girl, Diane, but I don't know, you might get a boy. You're golden that you get like, I would just realize that we're still, that she or he's still going to be exposed to just LA carcinogens. And so doing these occasional detoxes, if you're going to vaccinate, which I assume you'll do some beginning vaccines, I don't know what you're going to do, you want to set up a vaccine protocol where once she only gets one at a time, you're doing a detox protocol, like you're doing everything you can to just support her immune system. Like immune health and nervous system health are your main things, in my opinion, when it comes to like providing any pet the most in longevity, like giving them the most kind of hope for a long life, is going to be nervous system and immune health. That's it, in my opinion. I mean, there's so many other systems in the body, but I'm
Yeah.
assuming it's a pretty healthy dog. Like if you focused on those two, so keeping the things that would support the nervous system and things that would support the immune system starting young, if we all knew that when we were young,
Right.
there's a lot of young people on this call, but whatever. Like, I'm just saying, like, I wish I could go back. And now with my kid, I'm trying to do that stuff, right? Like
Yeah.
detoxing after vaccines and doing those things that I wish I had known a little bit more about.
Yeah.
Diane, does that answer your question a little bit? And I can obviously help you with that stuff too as you go through.
Diane, you can
I
unmute.
saw you unmuted me. Yeah, no,
Yeah.
that does help.
And Diane, and just for anyone, I will say this, like, listen, I might be a nutritionist and I might raw feed, but Dr. Hazzah is absolutely right. I put a link to, there's a test from VDI Lab, even raw fed dogs, even if you're balancing everything completely, right? Your dogs can still be off, and there's an essential vitamin lab that they can run. I'm not ashamed to say that my raw fed dog was like low in folate and she was low in magnesium, right? So even if you think you're doing everything right, you know, what I always say is trust but verify, right? And that's a lab that your vet should be able to get and run pretty easily. It cost me about $140 to have those 4 vitamins tested. So it's magnesium, um,
Bees. Yeah.
folate, and vitamin D. And a lot of those are immune supportive, as Dr. Hazzah mentioned. So, you know, setting up your animal for success, you want to make sure that, you know, like she said, their immune system's in place. So,
And then
Apple
there's
had all of the testing done within the last month of her life, and everything on those tests was normal, including
great.
low glyphosate. Well,
I mean, some of it's genetic too, right? Like that's the problem. And,
Yeah.
you know, Dr. Popo says like, so little is genetic and most of it's environment based off of some of the human studies. And I think I still think genetics still play a really big role. I mean, Golden's, like she just is stuck with, I mean, she didn't get hemangio because of the glyphosate that she wasn't exposed to, or you
Right.
wonderfully helped detox her from. Diane and fed her really well. I think it's just sometimes it is just genetics. And you can do all of this. I have dogs that come to me at 18 months with really bad cancer.
Oh my
And
God.
they have been feeding raw. They've been doing everything. And it is definitely not environment. They don't get cancer at 18 months. And so it just, unfortunately, there's a genetic mutation that caused that, right? So you just do everything you possibly can to give them the best chance. But you can't control it all. The VDI Labs also has mineral testing that you could do as well. You can do mineral and vitamin, which is great, a great combination. I think the mineral is what with hair and the blood, and the other ones with blood, the vitamins with blood.
Yeah, it's a combination of the two. Yeah. All right, we want to take one last question because we're just about at time, and this is from Larry. Larry's joined several of our last few classes, so great to have you, Larry. Larry says, my 4-year-old chocolate lab had a mast cell tumor the size of a pencil eraser removed from the skin near her front left shoulder. Oncologist tested spleen and lymph nodes for cancer and ultrasound on organs and found no spread of the cancer. That's great. The doctor still recommended chemo. Why chemo if it had not spread? There seem to be very many holistic alternatives.
Yeah, so chemo is usually recommended because of one of two things. Either it spreads, so what we call the stage of cancer is high, or if the grade of the cancer is high. This is what we were talking about with Lisa. Like, even though Brooklyn, she was diagnosed with this more of a high grade tumor. That's why we went through chemo and Palladia and then chlorambucil. And so I think that I'm going to guess, and I don't know, Larry, if maybe just the grade was high, but if it hasn't spread and it was a low grade, oncologists generally don't recommend chemo. It has to be one of the two, either a high grade or a high stage. You can always combine it along with alternative, or you just do alternative. And even with high grade, I have some patients that have come to me and they don't want to do anything other than more of an alternative regimen. And so we just do that regardless of the grade or the stage. So it's very much up to you what you decide.
Yeah, and Larry, keep in mind, if I always encourage everyone to get a second opinion. So you're always welcome to reach out to Dr. Hazzah or go to the Green Nile because she knows a lot. So great question. Thank you, Larry. All right, so Dr. Hazzah, we don't, you have already given us an hour of your time and we so appreciate it. So folks, as I mentioned at the top of the hour, this is the third in the series of 5 because we're in a leap year. Congratulations, all of us, we made it. We're doing 5 classes this month on canine cancer awareness, and I'm putting a link in the chat where you can view the rest of our upcoming classes. I'm just going to screen share real quick so that you can see what else we have coming up. So next week we have a course on how hemp and fungi kill cancer with Angela Ardolino of Your Natural Dog and CBD Dog Health. And then if you don't live somewhere near a small business where you can get some of these cancer preventatives and CBD and stuff like that, we're actually highlighting 3 women-owned businesses who carry our favorite lines of cancer preventatives and treatments. Also really high quality food because as Dr. Hazzah has mentioned, like a high quality food diet is very crucial in the fight against cancer. And then I'm really excited to share that March we're kicking off, speaking of food, why quality dog food matters. And if you've never heard of Susan Thixton, go Google her right away. We call her the Erin Brockovich of the pet food world. She is our tireless consumer advocate, and she is taking these big pet food companies to task. So definitely check it out. The other thing I just want to recommend, our resources page, we have all these sections here where Wendy and I have compiled the brands as nutritionists and as people who've been doing this for a long time feel are the best of the best. So we have fresh food, dry food, chews and supplements, herbal and natural supplements. Our favorite health and behavioral professionals, including Dr. Trina Hazzah, there she is, Green Nile,
Thank you.
and educational offerings as well as books, if you want to learn more. So that the resources are out there. We encourage you to educate yourself. You're already doing it by showing it up here. And of course, Dr. Hazzah was kind enough to let us record this session, so it will be available within a few days on our YouTube channel. And so just thank you, because you could have done a lot of other things with your time this night or this morning if you're Lisa in Australia. And we appreciate it. And this is why you're the reason we do this. Because nobody should have to struggle to find answers to help their dogs live their best life. So Dr. Hazzah, thank you. You really are a gift. We so appreciate your time, and thank you for all you do and letting us know how we can help our animals. And any last words for the kids at home?
Oh, it's me?
Yes.
Sorry, I was waiting. I was waiting to see if you were going to say it. No, thank you all. Like, thank you for having me. And I look forward to helping as many pets as I can. So feel free to reach out to me if I can help you all in any way. Lisa, I know I'll talk with you soon. And Diane, I'll tell Landon at some point, I promise. I'll let you know how that goes. But no, everyone, thank you for listening. And, and really being that, I would say, empowered, like being empowered and standing up for your pet and doing the right thing for your pet. It's not easy, especially when you walk into a vet office, a conventional vet office, and they're saying, that's stupid, just feed this dog the bag of dog food or whatever it may be. I know it's not easy. We are on the same side as you, where it's not always easy. But you're doing it because you're doing it for your best friend, right? And so that's why we wake up every morning, many of us as integrative doctors, and say, like, we got to do the best we can do. And we're human. We all make mistakes, but our pets are relying on us. And so really, like, thank you for being on this call, listening in, and doing everything you're doing to give your pets the best quality of life and the longest and best quality of life that they can have. Really. So thank you. Thank you. Thanks for having me on.
Absolutely. As my departed grandmother would say, you're doing the Lord's work. So well, thank you so much, everyone. Have a great rest of your day, and hopefully we'll see you next week for how hemp and fungi kill cancer. Take care. Thanks, Dr. Hazzah.
Thank you. Thanks for having me. Bye-bye.